The most frustrating advice you hear when your knees hurt or your legs feel weak is the same advice doctors repeat again and again. Take painkillers and rest more. Take Advil, stay off your feet, wait it out. But here's the uncomfortable truth most people never hear. You can take painkillers every single day. You can rest for 18 or even 20 hours a day, and still, your joint pain will not go away, and your legs will continue to get weaker if two critical vitamins are missing from your body. That's why so many seniors feel stuck. The pain doesn't improve. Walking becomes harder. Stairs feel dangerous. And slowly, confidence in your own legs disappears. Most people are told this is just part of aging, that weak legs, stiff knees, and sore ankles are something you have to accept after a certain age, but aging itself is rarely the real cause. In reality, ongoing joint pain and leg weakness are usually warning signs that something deeper is wrong inside the body. And the more you rely on painkillers and rest alone, the worse that hidden problem becomes. In this video, I'm going to show you what's really happening and why the common advice you've been following may be keeping you stuck in pain. One of the biggest mistakes seniors make is believing that weak legs and joint pain are simply the price you pay for getting older. When knees ache, ankles feel stiff, or legs feel unstable, most people immediately blame age. They're told their joints are wearing out, their muscles are naturally weakening, and that there's not much that can be done except slowing down and resting more. But this belief is deeply misleading. If aging alone caused weak legs and painful joints, then everyone of the same age would experience the same level of pain and weakness. Yet we all know that isn't true. Some people in their 70s and 80s walk confidently, climb stairs without fear, and move with strength, while others struggle just to stand up from a chair. The difference isn't age, it's what's happening inside the body. Joint pain and weak legs are usually symptoms, not conditions by themselves. They often signal chronic inflammation, poor nutrient absorption, muscle breakdown, or a deeper imbalance that has been developing silently for years. And here's where the common advice makes things worse. Excessive rest doesn't protect your legs, it weakens them. Muscles shrink when they're not used. Joints become stiffer when movement stops. Blood flow decreases, healing slows, and pain becomes more persistent. So instead of fixing the real problem, resting and blaming age often accelerates the decline, locking people into a cycle of weakness, stiffness, and fear of movement. When joint pain refuses to go away, most seniors are pushed toward one solution: stronger painkillers or taking them more often. Medications like Advil, ibuprofen, naproxen, and similar drugs are seen as harmless because they're common and easy to access. But this is where a dangerous misunderstanding begins. These painkillers don't fix anything. They don't heal joints, rebuild muscle, or restore strength in your legs. They simply block pain signals for a few hours. And while that temporary relief feels helpful, the damage happening behind the scenes continues to grow. Even more concerning is what long-term use of these medications does to the body. Regular use of painkillers has been linked to increased risk of heart attacks and strokes, kidney strain, rising blood pressure, stomach irritation, ulcers, and serious gastrointestinal bleeding. Many people don't connect these problems to the pills they've been taking for years because no one warned them in the beginning. There's another hidden cost most people never hear about. These drugs slowly damage the protective lining of your gut. When the gut is irritated and inflamed, your body becomes more inflamed overall. That inflammation doesn't stay in your stomach. It travels through your bloodstream and settles into your joints and muscles, making pain and stiffness worse over time. This creates a vicious cycle. More pain leads to more pills lead to more internal damage, and instead of getting stronger, your legs become weaker, less stable, and more vulnerable with each passing year. This is exactly why what you're about to learn is so important, because continuing down the same path, resting more and relying on painkillers, only guarantees more weakness and more pain in the future. But the good news is, this cycle can be stopped and reversed when you address the real cause. In this video, I'm going to show you two specific vitamins that work very differently from painkillers. They don't just numb pain for a few hours, they go after the inflammation, muscle loss, and joint breakdown that are actually making your legs weak and your joints stiff. These nutrients work from the inside out, helping your body heal instead of just masking symptoms. I'm also going to reveal two very common pills that many seniors are taking without realizing they're quietly sabotaging their joints, muscles, and bones. These medications weaken your legs over time, no matter how healthy your diet seems. By the end of this video, you'll understand what's really driving your joint pain, why your legs feel less stable than they used to, and what you can start doing to rebuild strength safely, without depending on pills that create more problems than they solve. Most people are told that joint pain is simply arthritis, a natural wearing down of joints over time. But this explanation is incomplete and often misleading. If joint pain were only about wear and tear, resting more should make it better. Yet for many seniors, the opposite happens. Pain becomes more persistent, stiffness increases, and leg strength continues to decline. That's because the real villain behind most chronic joint pain and weak legs is not age, it's inflammation. Inflammation is your immune system's response to damage or stress. In small, short bursts, it's helpful. But when inflammation becomes chronic, it starts attacking healthy tissue. In the joints, this leads to swelling, stiffness, heat, and pain. In the muscles, it interferes with repair and accelerates muscle breakdown, especially in the legs. Here's where painkillers quietly make things worse. Drugs like Advil and other NSAIDs work by blocking pain signals, not by stopping inflammation at its source. While you may feel relief, the inflammatory process continues underneath. Over time, these medications damage the lining of your gut, which plays a critical role in controlling inflammation throughout your body. Your gut is home to trillions of beneficial bacteria that help regulate your immune system. When painkillers disrupt this balance, the gut lining becomes weakened and more permeable. This allows inflammatory compounds to leak into the bloodstream. Once circulating, these compounds don't stay in the gut. They travel and settle into vulnerable areas like the knees, ankles, hips, and leg muscles. This creates a destructive chain reaction. Gut damage increases inflammation. Inflammation worsens joint pain and muscle weakness. The pain leads to more medication use, which further damages the gut. Over time, this cycle accelerates muscle loss, joint stiffness, and instability in the legs. Until this inflammation-gut connection is addressed, no amount of rest or pain suppression can truly restore strong, stable, pain-free movement. This is where the approach changes completely, because instead of masking pain, you begin correcting what's driving it. One of the most powerful nutrients for this is omega-3 fatty acids, commonly found in fish oil. Unlike painkillers, omega-3s don't just interfere with pain signals. They work at the cellular level to calm inflammation itself. Omega-3s contain two key compounds called EPA and DHA. Once inside your body, these fats become part of your cell membranes and directly influence how your immune system behaves. When omega-3 levels are low, your body tends to produce more inflammatory chemicals that attack joints and muscles. But when omega-3 levels are adequate, that inflammatory response is reduced, and your body begins producing special compounds that actively help resolve inflammation rather than prolong it. For seniors, this matters far beyond pain relief. Chronic inflammation is one of the biggest drivers of muscle loss in the legs and weakening of bones. Omega-3s help slow this process by improving muscle protein synthesis, meaning your body becomes better at maintaining and rebuilding muscle tissue. This directly supports leg strength, balance, and stability. At the same time, omega-3s support bone health by improving how your body handles calcium and reducing excessive bone breakdown, lowering the risk of fractures. There are also additional benefits many people don't expect. Omega-3s support heart health, improve circulation to muscles and joints, and help maintain brain function and mood, all of which become increasingly important with age. You can get omega-3s naturally through foods like fatty fish. Salmon, sardines, and mackerel are especially rich sources. Including these foods a few times a week gives your body the raw materials it needs to calm inflammation, protect joints, and support stronger, more resilient legs from the inside out. Omega-3s don't just reduce pain, they create an internal environment where healing becomes possible. Now here's the critical piece most people completely miss. Even if you start taking omega-3s or eating more fatty fish, many seniors still don't get the results they expect. The pain improves slightly, but the weakness doesn't fully resolve. Joints still feel unstable, and that's because omega-3s alone aren't enough if the foundation they rely on is damaged. That missing piece is collagen. Collagen isn't just about joints. It plays a central role in repairing the gut lining, the very place where inflammation begins and where nutrients are absorbed. Years of poor diet, stress, and painkiller use slowly damage this lining, making it leaky. When that happens, inflammatory particles escape into the bloodstream and spread throughout the body, settling into joints and muscles. This is why inflammation becomes chronic and hard to shut down. Collagen provides specific amino acids that help repair and seal this damaged gut barrier. Once the gut begins to heal, inflammation levels drop, and nutrients like omega-3s can finally be absorbed and used properly. This is why collagen and omega-3s work best together, not separately. Beyond the gut, collagen is literally the building material of your cartilage, tendons, ligaments, and bones. It helps restore the cushioning in joints that prevents painful bone-on-bone contact. It also supports muscle tissue, helping slow the muscle loss that makes legs feel weak and unstable with age. Improved blood flow to muscles and joints further enhances healing and strength. This is why studies have shown that seniors who add collagen to their routine experience real improvements. Not just less pain, but better mobility, stronger legs, and improved physical function over time. Collagen doesn't just make pain quieter, it helps rebuild the structures that movement depends on. Without this missing piece, inflammation keeps returning. With it, the body finally gets the support it needs to heal properly. Now, everything you've learned so far, the omega-3s, the collagen, the inflammation control, can be completely undermined if two very common types of pills remain part of your daily routine. And this is where many seniors unknowingly sabotage their own recovery. The first is the overuse of antibiotics. Antibiotics can be life-saving when truly needed, but frequent or unnecessary use quietly destroys the beneficial bacteria in your gut. Those bacteria are responsible for helping you absorb key nutrients and for producing compounds that protect bones and muscles. When they're wiped out, inflammation rises, calcium is misdirected, and muscle breakdown accelerates. Weak legs, fragile bones, and worsening joint pain often follow, even in people who eat healthy. The second is long-term daily use of NSAIDs like ibuprofen and similar painkillers. Taken occasionally, they may help short-term pain, but used daily, they damage the gut lining, block cartilage repair, reduce blood flow to muscles, and actively interfere with healing. Over time, they don't just fail to fix joint pain, they make joints and legs weaker and more unstable. So here's the question I want you to think about honestly. Which of these medications have you been relying on without realizing the long-term cost? Share your experience in the comments. Many people discover they're not alone. And if you want to go deeper, my next video reveals a common breakfast mistake that quietly drains calcium from your bones and makes legs feel weaker every morning. Most seniors make it without knowing, and the fix takes less than 30 seconds. Make sure you don't miss it.